And we're back on Second Street talking about innovations in healthcare that can improve access for patients. My next guest is Alon Birshtein. He's the CEO of Care and Family Health. Alon, thank you so much for taking a few minutes to chat. Could you just tell us maybe a little bit off the top about your company? How does it work for a patient that is going to be accessing your services?
Sure. Thanks for having me. So Care and Family Health is a family clinic powered by nurse practitioners, meaning our primary care providers are practitioners instead of family doctors. We do everything at the primary care level. We do everything that you would expect in a full service family clinic. And we've also basically paired the clinical operations with the development of the platform that we use in order to deliver those services. So everything that our practitioners and everything we use to manage the clinical operations in the background, as well as the patient apps that give patients access to their health records, give them access to all kinds of tools and information to easily access, as well as information, as well as access health resources, booking appointments, telemedicine, so on and so forth.
So if I'm a patient and let's say I have a really bad sore throat or something like that, I can go into a physical location, talk to a nurse practitioner, maybe get a prescription for medication or have something diagnosed, but also maybe chat with him or her through the app as well. Is that basically how it works?
Exactly. That's basically how it works. So patients have kind of two ways to see us. They can either subscribe to our annual plan, and then they get
Mm-hmm.
basically unlimited telemedicine, unlimited clinic visits, and basically unlimited access to us. And then we also offer our services for kind of more episodic things on a pay-per-use basis. So you could just book one appointment if that's all you need, and get whatever it is, whatever episodic kind of event that you're having looked at.
Okay. And then how does it work with your company in terms of size, locations? Can you give us an idea of like how many patients you're treating or that are maybe subscribers of your service?
We have probably about almost 35,000 registered patients since our
Mm-hmm.
inception. We see about 100 patients a day right now, and that's kind of growing, scaling as we scale our operations. But that's
Mm-hmm.
kind of the scale that we're operating at.
Okay. And then how big is this market right now? It seems to me, like, correct me if I'm wrong, but it seems like it's kind of a new emerging market rather than, say, something like visiting your family doctor, which has been around for decades and decades and decades. Am I right? Or is this sort of a newer opportunity for patients?
Yeah, it's definitely a newer opportunity for patients. Not only is it a new model for patients, but it's also a new kind of practitioner that not all patients are even aware that, there is such a thing as a nurse practitioner and what exactly it is that they do.
Mhm.
So, a lot of kind of our beginnings were educating the patients on kind of like what we can offer, what we can actually do for them. And then,
Mhm.
as we grew and word of mouth kind of started to take over, then already kind of people already had experienced us and were kind of already had their personal experience that they could kind of share on with their friends in terms of what to expect from this kind of different model.
So we've got a little over a minute here, but we'll pick up on this after the break. But it's well known in Canada that we have a shortage of doctors. Um, it would seem that what you are doing would help because you're taking some of the pressure off of the system, and you're also giving patients an opportunity to actually get access to care. But at the same time, it seems from headlines that some in government are not so keen to have this system existing where patients are paying to get healthcare. Could you tell us maybe a little bit about this barrier that you're now facing or could be facing?
Yeah, I think this has been an ongoing debate already for decades in Canada in general, in terms of whether two-tiered, private, all kinds of different labels have been ascribed to it. But I think in the general sense, Taking us specifically, for example, we don't charge OHIP for anything. So, we're a net positive to the system, right? Like any patients that pay us for our services are basically, we're alleviating that burden off of OHIP and off of the current providers for them to be able to give that to basically other people.
Okay, we'll pick up on this after the commercial break.